We've been hearing that Israel is giving a second booster shot to those that are considered high risk.
Meaning that is now a fourth dose with the goal of boosting the immune system while there is so much infection and such high positivity right now. 9 Health expert Dr. Payal Kohli joins us this afternoon. Okay, so Dr. Kohli, fourth dose, what do we know about it? What kind of risks might be part of this? What would you be advising people considering it?
So Jenny, more is not necessarily better. So you're thinking about the fourth dose of a messenger RNA vaccine in less than a year. Now, in theory, that sounds good because we have a little bit of data out of Israel, a small study about 150 patients, that if you give a fourth dose, you can boost the antibodies 5-fold at about a week. But the question that I'm still asking is, does this mean that we're actually protecting you better against infection? Or is it just the antibody number that's going up? Is it keeping you out of the hospital? And is it worth the risks of a fourth dose? And those risks could be potentially real. So a lot of experts are talking about a phenomena called immune fatigue, which means that you exercise your immune system too much, it's going to get tired. So you may paradoxically actually be suppressing the immune system by activating it too many times. There's also myocarditis that we have seen that can occur with the messenger RNA vaccines, where your body attacks your heart and causes inflammation. And we can also get what's called vaccine sensitization, which is an allergic reaction sort of a phenomena triggered by the vaccine. So we got to tread cautiously and get more data.
Plus, I'm not sure that people, as you mentioned, the fatigue, and it's been hard enough to get people to get vaccinated and then a booster. So, but now we're hearing Pfizer saying they have an omicron-specific vaccine. It might be out in March. Is that something you think would be a good idea?
100% yes. So I want to be clear, we're talking about a fourth booster here. We're not talking about the third booster. The third booster absolutely protects you against hospitalizations. But for me personally and for my family, what I would recommend is, why not get the better version? So it's really like a software upgrade for your immune system, because so far we've been counting on the vaccine from 2 years ago to offer us protection, cross protection against Omicron. When and if this vaccine becomes available, which I'm really optimistic, that's the booster that I want to get.
Makes sense.
I'm hearing conversation now because it's running so rampant in our community. At this point, let's just catch COVID, get it over with, move on with our lives, especially if the symptoms are mild. Now, obviously, it's a really callous take. Dr. Kohli, what do you as a health professional think about that concept?
You know, I'm hearing it all the time as well, including amongst healthcare providers, and I would really advise against it for many reasons. The first is long COVID. We know now that Omicron can cause long COVID. It can cause damage to your heart, your organs, etc. So it's not something you want to take lightly. The second is, we're actually seeing a higher incidence of vaccinated, boosted people end up in the hospital with Omicron. So it is something that you could still get pretty sick from, even though the likelihood is lower. And the third is, probably the most compelling reason, is you can get it over and over again. We all know at this point people who've gotten COVID multiple times, so getting it now does not give you a pass to not get it in a few months.
Yeah, I know people that are saying they're still fatigued months later, and just the idea of being tired doesn't sound good to me. So what about if you do test positive? Most people are just kind of waiting it out right now, and so many are testing positive, but there are some treatments maybe that we should be considering?
Yes, so if you know a friend that tested positive or a family member, be sure to tell them to call their doctor, because we're in a different place now than we were a year or two ago when we just had to wait it out. We have treatments that could change the course of the illness, in particular antibody treatments that have to be given within 3 days, or antiviral treatments that have to be given within about 5 days. So the minute you get that positive test, pick up the phone, call your doctor, see if you're somebody who's high risk and would qualify for one of these therapies.
The staffing problems around so many people getting sick are just wild to watch right now. Some states like California, Dr. Kohli, are letting their healthcare workers go back to work with a mask even the day they're positive. That's just wild to me. I'm curious what your reaction to a policy like that is, but also understanding we have to staff hospitals. And is this something that you'd be surprised if we see that happening more maybe here in Colorado?
Honestly, I am stunned and I'm speechless, because this is not science. This is them in crisis mode, trying to prevent their infrastructure from collapsing by allowing people to do this while they're positive, to go back to work, potentially spreading the infection. So I hope that here in Colorado, we never get to that. I want us to take this as a warning of what might be looming on the horizon for us if we don't start getting those case numbers down and start doing more mitigation measures. Because the last thing that is a sound thing to do in the middle of a global pandemic is to allow a policy like this. So I'm really shocked and stunned that it's happened.
Okay. we really hope that there's going to be a day that we're going to be able to talk about seeing the end of this with you soon. But in the meantime, the smell of Lysol surrounds us right now. So I know that makes you happy, Dr. Kohli. Thank you.
That.